Welcome to this patient audio guide about healthy lifestyle changes for psoriatic arthritis. This audio guide is produced by the nonprofit CreakyJoints and the Global Healthy Living Foundation and is made possible with support from AbbVie. Maybe you or someone you love suspects you could have psoriatic arthritis, or PSA for short. Or perhaps you have been recently diagnosed with psoriatic arthritis. Or maybe you've had PSA for a while, but you're experiencing new symptoms or are concerned that it's getting worse. This audio guide series can help you learn more about psoriatic arthritis and how it affects your health so you can manage it better and start feeling better. Remember, this is not a substitute for professional medical care. Always talk to your doctor about issues concerning your health and medical condition. To learn more about what it's like to live with PSA and to hear from fellow patients like you, check out the Psoriatic Arthritis Club podcast, available wherever you listen to podcasts or at psoriaticarthritisclub.org. In our other audio guides, we explain that PSA is a chronic inflammatory disease that can affect your skin and joints, as well as cause other symptoms like fatigue. We address the fact PSA often needs to be treated with medication to reduce inflammation in order to prevent irreversible joint damage and control other symptoms. But living a healthy lifestyle is also important in the overall management of your psoriatic arthritis. This audio guide will provide an overview of how healthy lifestyle changes can impact your PSA management. First, let's hear from Dr. Eric Ruderman, a rheumatologist at Northwestern University, about how lifestyle changes fit into your overall PSA treatment plan.
I think it's going to make you feel better. I think a healthy lifestyle is going to help you feel more functional. It isn't going to control the underlying disease process necessarily. And I think that's one of the things I do try to stress to people. It isn't that you can say, oh, I'm going to eat better, I'm going to exercise, and that's going to make this go away. Because we don't think it will. It may help control some of the symptoms. It may help control how much it affects you and affects what you do, but it isn't going to make it go away. And so I really try to encourage people to think of that sort of stuff, whether it's diet or activity or exercise, as an adjunct to what we're doing as part of our medical plan. They go together. They're not one or the other. They're really sort of part and parcel. They go together in managing disease.
What's more, managing PSA with medication that reduces inflammation and disease activity may help you live a healthier lifestyle. When you have less pain and inflammation, you may sleep better and have less fatigue. You may have more energy for physical activity and preparing healthy meals, which in turn may help you better manage your PSA. Here's how rheumatologist Dr. Grace Wright thinks about it.
It's important to recognize that when you treat the underlying drivers of inflammation, that there are many added benefits. So, yes, sometimes the depression, the stiffness, the fatigue, the ability to be present at work, the ability to connect with others socially. It's really hard to maintain that social connectedness when people are sort of backing away from you because you've got these swollen joints and flaring red skin, and they don't really understand why that's the case. So, this total approach to care has all of these unintended or intended consequences that are beneficial to patients. It's about your wholeness as a human being that we want to make sure you're reconnected, you're engaged, and you're able to function well.
The importance of treating the whole patient ties back to how doctors evaluate how well controlled your PSA symptoms may be, and how making healthy lifestyle changes may impact your symptoms. This idea is similar to a clinical assessment measure called minimal disease activity, where rather than looking at one or two symptoms like just skin symptoms or just joint pain, minimal disease activity takes into account many different aspects of psoriatic arthritis in order to make sure that the condition is getting better across many aspects of the disease. To assess minimal disease activity, your doctor will ask about or check for tender and swollen joints, whether you have any enthesitis, inflammation of tendons and ligaments, how much of your skin is affected by psoriasis, patient reports of pain, daily function, and how you're feeling overall. You have to score low in most of these areas in order to be considered to have minimal disease activity. And making healthy lifestyle changes as part of your treatment plan can be an important part of working to manage your overall health. Here's Dr. Alexis Ogdie, a rheumatologist at the University of Pennsylvania, discussing how lifestyle changes can help improve your PSA management.
I cannot overemphasize how important it is to have a healthy lifestyle. And there's so many reasons why, but I'll give you a few. So number one is function, and how you're functioning in life is so much more than just your disease. So you have a lot of power to help with your own function, and that's through exercise, making sure all the muscle groups are working well. A lot of people say that when they first start exercising, they get extraordinarily fatigued and they have more pain. You got to make it over that fence, and then regular exercise will actually help keep your functional status up. Number two is diet matters. Patients with psoriatic arthritis have a really high prevalence of obesity. Obesity impacts function, but obesity also impacts the likelihood of your response to therapy. So if you can maintain a healthy weight, you're much more likely to respond to your therapy. In addition, maintaining healthy mental energy is so important. If you think about just like anything going wrong in your day, if you have a if you're in a good place mentally and emotionally, you're much more able to deal with that. Well, the same thing is true for psoriatic arthritis. Let's say you have a flare. If you're in a good place emotionally, you're going to be able to deal with that a lot better. Additionally, depression, anxiety, and stress cause flares, and they actually increase the disease activity that you're experiencing, or increasing the impact of the disease on your life.
So let's talk about the components of managing PSA with healthy lifestyle changes. It starts with being physically active. It's always a good idea to talk to your doctor about safe physical activity for you. A mix of aerobic exercise, stretching, and strength training is often recommended, but it needs to be catered to your abilities and level. If it's been a long time since you've been physically active, consider this tip from Dr. Ogdie.
Physical therapy is a great place to start if it feels like too much at first. Water therapy is actually a great place to start because it's getting into a warm pool where they're starting to get things moving and you don't have the gravity on the rest of your body. So that's a great place to start if you're really having a lot of pain. Once you move from water therapy to physical therapy, kind of land physical therapy, they can start working on those different joint muscle groups that need strengthening, and other ones that need stretching.
Another issue is having enough energy for exercise. When you have fatigue, which is very common with PSA, exercise may be the last thing on your mind, but research actually shows that exercise can help manage fatigue.
Aerobic exercise can be really important. That's counterintuitive to people who are really fatigued, because you don't want to go out exercise and you feel like initially it makes you feel worse. But actually the best demonstrated therapy for fatigue is one of them, at least, is to go get regular aerobic exercise. And then over time, over the next few weeks, for example, 4 to 6 weeks, you will start to feel less fatigue. I also say that aerobic exercise, you don't necessarily need to go out there and start with like a 20 minutes every day. It could be if 5 minutes is causing you a lot of fatigue, start with 5 minutes or 4 minutes and then slowly build up over the course of a few weeks. So start slow and increase slowly.
Another component of a healthy lifestyle with PSA is diet. While there's no one diet that is recommended for psoriatic arthritis, it's generally a good idea to eat nutritious, well-rounded meals that include fruits and vegetables, beans, nuts and seeds, whole grains, fish, lean meat, and healthy fats like olive oil, and that limit sugar and highly processed foods. You may hear this referred to as a Mediterranean diet or an anti-inflammatory diet. Here's how a healthy diet can affect your PSA.
So a healthy diet is more than just being good to yourself, but it can help improve your energy levels. And number two, they decrease your risk for heart disease and help you maintain a healthy weight. Having obesity or being obese or even overweight is associated with poor outcomes for patients with psoriatic arthritis. And we want people to maintain a healthy weight so that they can respond better to their therapies.
A healthy lifestyle with PSA also means managing stress levels and mental health. This includes having stress-reducing activities in your routine and taking time for self-care. It's also good to talk to your doctor if you have any concerns about your mental health. They can advise on whether additional treatment, such as seeing a therapist or medication, could be helpful.
So at every visit, I ask about depression and anxiety. And one is because it's really, really common. It's common in everybody, but it's particularly common in psoriatic arthritis.
In some cases, people may not even recognize that they are experiencing mental health issues, and your doctor may help you identify that, as Dr. Wright explains.
The first thing that we can do when we have patients who have mental health issues is, number one, assess whether or not they're even aware that this is a mental health issue. Many patients don't realize that their behaviors are driven by depression. So the fact that you're always tired, you're never able to get out of bed, I may be able to uncover the depression. And even though I'm not an expert at treating the depression, I can refer you to somebody who can help. So, again, identifying the behaviors and getting people, number one, to accept that mental health is just that. There's physical health, there's mental health, there's emotional health, and this is an area that sometimes we need help with, and there are professionals who can assist with this.
In addition to exercise, diet, and stress and mental health, there are many other components of living a healthy lifestyle with PSA. You may want to try physical or occupational therapy. You can use treatments like heat or ice to manage pain and swelling. You may want to make changes to your routine to help you sleep better, such as having a set bedtime and minimizing your caffeine intake. And, of course, quitting smoking may help improve your PSA and overall health in many different ways. Keep in mind that you don't have to make all of these changes at once. Adjusting to life with a chronic disease is a lot, and make sure to partner with your healthcare provider on your PSA patient journey. They are there to help you. The more you tell them about what's going on, the more they may be able to help.
Patients should feel like they have a doctor who's partnering with them and listening to them and taking into account what's important to them. Every patient should have the opportunity to give their treatment goals, have their treatment goals heard, and have the rheumatologist give them a plan for how to achieve their goals.
Achieving treatment goals often entails a combination of medications and lifestyle adjustments. Here's an example from Dr. Ogdie of what this partnership could look like.
Let's say you want to be able to walk 2 miles, and you've only been able to walk around the block. So we should be able to help think through, well, what do we need to do that? Your knee is inflamed right now. Maybe we can do a joint injection to make the knee better. Then we need to get you to physical therapy so you can strengthen the muscles around the knee. And then you need to start slowly increasing your walking. You're going to do this little bit every time. And maybe we'll think about a knee brace to help get that knee more stable, because if it's wobbling while you're walking, that's maybe part of the problem. So we should be able to help you think through at a granular level, what can we do to get you to help achieve your goal?
We hope this audio guide has provided helpful information about healthy lifestyle changes for psoriatic arthritis and how lifestyle changes and medication work together to help you manage your condition. Psoriatic arthritis can be a complex condition to navigate, but remember that there are many effective ways to treat PSA, especially when you partner with your healthcare providers. You have what it takes to deal with this. We'd like to thank Dr. Ogdie, Dr. Ruderman, and Dr. Wright for their input and expertise. Keep listening to our audio guides for more about managing psoriatic arthritis. For more about what it's like to live with psoriatic arthritis, check out the Psoriatic Arthritis Club podcast, available wherever you listen to podcasts or at psoriaticarthritisclub.org. This audio guide was made possible with support from AbbVie. And for more information about managing PSA and to join a free, worldwide support and advocacy community of PSA patients and their families, visit CreakyJoints.org, which is a part of the nonprofit Global Healthy Living Foundation.